Hi everyone, my name is Lori Logrossa and I'm here to do my presentation for you. My topic today is A Counselor Who Has Relapsed by Lori A. Logrossa. Um, so, how do we help the helpers when they relapse? So, it's estimated that 38% of drug counselors relapse at some point in their career. What protocols are in place for the impaired counselor? Do we treat recovering drug counselors the same with the same dignity and respect that we treat other professionals? How do we proceed with employees and most importantly our clients? So let's start off with what the DSM defines substance abuse as. So substance abuse disorders are patterns of symptoms resulting from the use of substances that you continue to take despite experiencing problems as a result. There are 11 criteria that allow the clinician to accurately diagnose the severity of the disorder. Um, George Valiant, the grandfather of addiction, says that when you treat a disease without a cure, you treat it with hope. Hope is a memory for the future. So it's one of my favorite quotes from the semester. And you'll see why in our case study. So, a female drug counselor, Jane, has been employed at a local methadone clinic for 3 years. Jane has excelled in her position, but lately has been showing up late, leaving early, and even calling in sick. Jane appears to have lost weight quickly. She is often lethargic and has become disengaged with her clients. Upon questioning from her uh, coworkers, Jane quickly pulls her act together for a few days, but by Monday she comes in to work with dilated pupils and looks disheveled. Mary, her direct supervisor, brings Jane into her office and advises other staff to handle Jane's uh, and caseload for the morning until Mary is free to help. Mary then asks Jane what is going on. Mary knows that Jane is in recovery with what she believed to be 10 years of abstinence. Mary advises that if there is something going on and she needs to talk, and now is the time. Um, she continues on with what she has noticed as far as Jane's behavior, and as her supervisor and colleagues, she wants to help but also protect herself and her clients. One last time, Mary asked Jane, is there anything she needs to say or an action she needs to take before Mary takes further action as a supervisor? Jane then begins to cry and she confesses that she had recently relapsed with drinking wine that turned into cocaine and has led to opiates. Jane is scared and asks Mary not to tell the board what she has done or not to fire her. She said that she is willing to get help. Can Mary legally and ethically keep Jane's relapse a secret? What's the ethical and legal guidelines say about this matter? So, moving on. Autonomy and non-malevolence. Autonomy, the duty to respect and promote an individual's choice for themselves in achieving what they believe to be in their best interest. Mary, as the supervisor, must respect Jane's choice to seek help for her issues, obviously, while still protecting her clients. Jane's goal is to seek treatment as an alternative to being fired. Mary should respect Jane's wishes and follow the chain of command and protocol for seeking assistance if possible, uh, also considering company policies and procedures. Non-malevolence, duty to do no harm or to be caused to a patient through neglect. So, this case, there's two facets for this. So, obviously, Mary is conducting supervision and she has to do no harm to Jane, nor neglect the situation. Mary must be cautious in how she proceeds. Obviously, referrals for addiction treatment need to be made. Proper chain of command must be notified on an as need to know basis only. that needs to be explained to Jane at this time, and obviously with Jane's written permission only. Jane arrived to work and appeared to have been under the influence and has seen clients in this condition. Has she seen clients in this condition? Because clients have the right to non-malevolence as well. Um, and as a drug counselor, it can be extremely detrimental. You know, these people are in there for the first few days of recovery treatment. They're like hanging on, and your drug counselor is using drugs. You can't attempt to practice. You can't just simply can't practice in that state. So Mary really has to look at those two facets when looking at malevolence in this case study. Now, benefits and justice. Benefits is the act of charity. It's mercy and kindness with a strong connotation of doing good to others, including moral obligation. Jane is tearful and she's scared, right? And she is afraid of losing her position. And with drugs, really, Jane is scared she's going to lose her life, you know? So is Mary's job to help her it is her job to help her gather the resources she needs to regain her recovery and stop and also protect the welfare of the clients and the agency as a whole. Okay, and then justice is the empowerment of individuals and groups as well as the active confrontation of injustice and inequality in society, as both they impact clientele and their systematic contacts. So Mary is obligated to confidentiality within the realms of supervision, but also cannot hide the fact that Jane has used without a proper plan in place to change that behavior, okay? So documentation is needed very much in this instance as the protocols of the organization must be followed as well as legal and ethical guidelines. Jane should be empowered to heal, but clients must be protected as well. So that's where justice comes in this. It needs to be a clear chain of command, document it so that the best course of action can happen. You know, obviously to save Jane or to help Jane empower herself and get off these drugs, but also to seek to help and protect our clients, which we're there for. Then we have fidelity. It's the measure of the reliability of the administration of the intervention in the treatment study. Okay, what is Jane's plan of action? Okay, will she go to 30-day treatment facility? Must she undergo frequent drug testing upon her return? A strict documented plan must be in place so that if Jane does seek help and returns, she will understand that an infraction of any sort like this would mean termination in the future, possibly, you know. There must be a way to measure and document tangible evidence of recovery and ability to work with clients and to what degree. Obviously, if she's in this situation and she's on drugs, she cannot see clients right now, but interventions can be placed in there and they need to be measurable and tangible as to see how this is going to look. Is she going to take a drug test every week? Is it going to be random? What is she going to do to prove that she's eligible to work with clients again and competent? So that's where it needs to be measurable, tangible, because we want to empower Jane, but we also want to protect and empower our clients. So, veracity is simply being honest and telling the truth. Jane did tell the truth. When asked by her supervisor, Mary, Mary owes Jane the truth as well. Okay. So, and she needs to explain her rights and what the chain of command in such a situation looks like. And the plan must be documented in detail. That's how it's going to look at this point. All right, moving on. So let's get into some Maryland ethical codes. We have 3 for this case study that seem pertinent. So the first is 10.58.03.08, records, confidentiality, and informed consent. A counselor shall maintain the privacy and confidentiality of a client and the client's records. Release mental health records or information about a client only with client's consent or as permitted by Health General Article Title 4, Subtitle 3, and a noted Code of Maryland 3, release alcohol and substance abuse records or information about a client only with a client's consent or as permitted. So here we go. Let's apply this. Mary is bound to protect Jane's confidentiality. We've been saying it throughout the video. It's very important um, in this matter, and the referrals are made to the appropriate chain of command only once written consent is provided. Obviously, if Jane refuses to go forward with seeking help, this would be grounds for dismissal or whatever her agency does in that matter. But either way, Jane has the right to confidentiality. So 10-58-08-05, the counseling relationship. A client welfare and rights. A counselor shall inform clients of the purposes, goals, techniques, and procedures and limitations, potential risk, and benefits of services to be performed. Explain to clients the implications, diagnosis, the intended use of tests and reports, fees, billing arrangements, document attempts to inform other professional counselors, concurrently providing mental health services to the client. Obviously, Mary's not a client, but we are in supervision, so you're kind of the same spectrum right there. So Mary, and she's impaired, and she said that, So Mary must document every step of this supervision down to the T's. Jane has the right to be informed on the process that is about to unfold and what the possible alternatives are of her other actions. Like, say she says, "I'm not doing this." Well, let's talk about that too. It just needs to be there. It needs to be explained. It's a very serious situation. Number 3 for us today, we have the Maryland Code of Ethics 10-580303, professional competence. A counselor shall practice only within the boundaries of a counselor's competence based on education, training, supervised experience, and professional credentials. Jane is not competent. Jane is not competent right now to practice at this time. Under this guideline, alternatives must be developed to help Jane recover from her issues before she is able to work with clients in any capacity, and Mary must protect her clients and the agency under this guideline. My recommendations for this case. Given the fact that Mary must keep Jane's confidentiality, she must clearly explain the chain of commands. If Mary is unclear herself, she needs to seek supervision immediately. But Jane must understand that her confidentiality will be protected, and only with her own written consent will proper chain of command know and be best able to assist her. There's also a competency issue here. Jane is clearly not competent to provide drug counseling services. At this time, it's both legally and ethically. Her decision making is not there. So I apologize. Her decision not to seek alternative treatment would risk termination and possible issues with the Maryland board. But non-malevolence works both ways, as we said earlier. So she is employed to help clients, not there to hurt them. So she must practice self-care or be dismissed. So that's pretty much the things. The recommendations, my recommendation for the case would be that Mary needs to be clearly laid out the law. This is what we're going to do. We're going to come up with a plan of action. We're going to talk to the impaired board for impaired counselors. We're going to get her all the resources, look at the protocol that the agency has laid out. What they may say that this is not acceptable. I mean, obviously it's not acceptable in any agency, but each one has different recommendations. So at any rate, we would reach out to these services, get her the proper referrals with her consent, or otherwise she can go, because we can't do that, and that would be sad. So hopefully we can get her some help, because that's what we're here for. And just again, like they said in the beginning of the video, for a disease, there is no cure. Treat it with hope. So don't forget, that's very important. So that brings us to our very last slide. That's my reflection on my presentation. So as an addict myself, this is what I wrote. I understand that relapse is always a risk. However, I have also learned through this course and my own life experiences that counselors need to practice self care and seek therapy if they are struggling. I am not where I expected to be in my career um, because I was struggling and did not reach out. But I now understand that there are protocols in place that if you ask for help, you are um, you're not only helping your clients, you're helping yourself. So sorry if that seems a little unclear, but we need to talk with our supervisors. We need to practice self care. Uh, we need to participate in our own recovery. We need to utilize continuing education. Always review codes and ask questions if we do not understand. Um, my values would guide me to help Jane. Make sure she feels empowered and protected, but also hold her accountable. We are there to serve um, others. So just very quickly, again, I've been in this boat. I actually am not where I wanted to be in my own recovery or my own professional career because when I was in graduate school, I had lost my brother and I didn't reach out. I didn't get into therapy, and then my last semester, I was engaged and he died, and then my dad died, and I did all these things, and instead of being like, hey, I'm messed up because I had other personal things going on, and I just kept using drugs. And that's what I did, and I didn't reach out. And then my addiction spiraled out of control. I tried to go back, I tried to do all these things, but I was messed up. I was so messed up on drugs. So, and now, a few years later, I've really engaged in recovery. I've been clean for a minute, like I really, for pretty doing pretty good with that. And yeah, so and it's amazing like how far I've come. But I stay here because I do these things. I still engage in meetings. I still, I have a church I attend for my own spiritual beliefs, and I help others. I do service. I'm doing all the things because I want to give back. Because I was that girl that was sitting there, um, maybe not exactly the same, but I've gone to these places and I just, I wanted to help others, but I couldn't. I was broken and I was messed up, and I have the disease of addiction. I do. So I know that it's a very, um, it's scary because it can happen to anyone, but you just have to keep continuing these things. Like. Um, yeah, I mean that's just the way it is. Like it's scary because it can happen to anyone. 38% kind of gives me chills myself, but I understand at the end of the day that if we follow the guidelines and we ask for help, things like this necessarily don't have to happen. You don't have to relapse. You don't have to do these things. You just have to continually work because, like they said, it's a disease with no cure. So how do you cure it? With hope. So that's how I do it. So anyway, that's my presentation. I've really enjoyed the class, and I hope you enjoyed my presentation. And see you later.